side of the arm, and the hand's kind of like this, where the thumb is on this side, and then the pinky finger's on that side. I've drawn out the bones in orange, so this is actually the spine of the scapula. It kind of comes out right here. Here's the glenoid cavity. That's part of the scapula, right? And then this guy, that is the clavicle. So you're really looking at like that view, right, of the skeleton. Everybody with me on that? So we're gonna fill in and we're gonna draw the positions of the major muscles. I think that a good one to start with is actually the brachialis, right? So the brachialis, if you look at the lateral view of an arm, he actually makes a little bump right there. So we know that the bicep is obviously right here, and the triceps on the posterior side of the arm. Right in the middle, you'll see the brachialis. The brachialis is a major arm flexor, or elbow flexor, and what he does is his origin is halfway down this arm. Right down there at the humerus. That's called the radial tuberosity. That's that little bump right here on the radius. Remember that little bump that was kind of like right there? This guy's like in my way. So there was like a little bump that was right there on the humerus. That's your, not radial tuberosity, that's your deltoid tuberosity. So this brachialis, what he does is he starts right here, and he actually curves all the way around and inserts on the ulna. So he starts right here, and he curves all the way around and goes to the other side and inserts on that ulna. So he's going to go like that. So he curves around and he inserts on the ulna. And you can kind of see that if he were to contract, he just calls his elbow flexion. So this guy in blue, he's the brachialis. Okay? And we'll kind of draw like a little bigger bulge like that. He starts right there, curves around, and then inserts on the ulna right there. He's probably one of our main elbow flexors. Then, let's talk about the biceps, okay? The reason I drew the brachialis first is because the biceps actually sits on top of the brachialis. We'll draw the biceps in green. Biceps has two heads. That means he has two sites of origin. He's got one site that starts right here on the coracoid process. Remember the coracoid process of the scapula? That's that little, protrusion right there. That's the short head. So the short head starts right there at the coracoid process. I kind of drew that right here in orange. The long head, what he does, he actually comes up, goes between the greater and the lesser tubercle. That's called the intertubercular sulcus. He wraps on top of the head, and he attaches right on top of the glenoid cavity. So you got the short head that starts at the coracoid process, the long head that starts at the top of the glenoid cavity. This guy stretches down, and what he does is he's going to come down here, and he's going to attach right onto the radius at the radial tuberosity. Remember that little bump, the radial tuberosity? So this guy's going to come down and attach right there. Because he comes like this, he really is going to go on top of that brachialis, like that. So that means we kind of have to erase some of that brachialis, because he's deep now. So I'm going to erase that part of the brachialis like that, because we can't see him anymore, because he's covered by that bicep. So the bicep is all of these green fibers that are running down. And that's what he kind of looks like. Hopefully you can kind of see where he stretches from, I'm going to outline this guy too, just so you can get a really clear picture of what he's doing. So here's the bicep from this view. He stretches down and attaches right there. And on this side, he comes down and attaches like that. So everything in green, this is biceps.
So what is the origin or the insertion for this?
The insertion is that radial tuberosity.
Right. Okay.
Right. Two origin sites: short head, coracoid process, right here. Long head, top of the glenoid cavity. They wrap together and they insert right there on the radial tuberosity. He does two things. When he contracts, he obviously like flexes your elbow. We know that, like curls, work your bicep. But he also, because he only attaches to one of those bones, he actually causes the forearm to twist. He causes it to supinate. Right? He's one of our main supinators. And we're actually pretty strong at supination. You can test this out. If you grab a marker in your hand like this, you put it under the desk, and you try to twist up, it's going to solidly activate your bicep. Right? Yeah.
So this is the clavicle,
That's right.
and this is the
Humerus.
brachialis.
Humerus. Right. The brachial
The
region.
muscle?
Oh, no. Yeah, let me see. Yeah, that's right. That's the brachialis right here. That's it.
And this
Bicep.
front one is the bicep.
That's right.
Brachial.
That's right.
This is the brachialis.
Okay.
And this is the bicep.
Yeah, the brachialis is like right there. Now, right, and that brachialis goes underneath the bicep. You know how screwdrivers, if you grab a screwdriver, you turn it clockwise, that screws the screw in? That takes advantage of our strong bicep muscle. Like we're much stronger at supinating things, twisting things clockwise with your right hand than pronating things. So to screw it in, you supinate, right? Before we had power tools. Okay. So that means I'm gonna go ahead and outline the good old brachialis right there. He cruises underneath the biceps. Now we can talk about the triceps, okay? The triceps is a pretty large muscle. He has 3 heads by his, that's the significance of his name. This guy is a major elbow extender. And we know that, like your tricep is active when you extend your elbow. The insertion side of all these guys is probably the most important thing. Anybody knows where the triceps inserts? What's the name of your elbow? Olecranon, right? So he attaches right here on the olecranon. That's the ulna, so that's where he's going to attach, is right here on the olecranon. The triceps has 3 heads. He's got a lateral head. That's the bump that you see, that we're going to see from this view. We're only really going to see the lateral head. On the medial side, he has 2 other heads. He's got the medial head and the long head. But we're really only going to see that lateral head from this view. The lateral head, his origin is right here at on the humerus. So he's going to come down like this and insert like that. And you're going to have, what does his fiber angle look like? His fiber angle, thanks. They kind of come in pointing towards the tendon. So it kind of looks like this. And that's your tricep. Lateral head specifically. Guess what? Those are the major muscles of the arm. Okay? The shoulder muscle, which is our deltoid, he actually is going to cover a big portion of these muscles. Your deltoid will, we'll draw this guy in red. What the deltoid does is this abducts our arm. He lifts the whole arm at the shoulder. The deltoid has a huge origin. He starts right here at the distal third of the clavicle. His origin stretches all along the clavicle, all along the acromion, and all along the spine of the scapula. So that's the whole origin of your deltoid. So this deltoid is his origin stretches from here all the way over to about right there. And this guy stretches down and he inserts right here at the deltoid tuberosity. The same place that brachialis muscle starts, that's where the deltoid stops. So let me fill this color in so we have a complete picture. Alright, good. So in this case, I gotta erase all this stuff here because we gotta make room for the deltoid, which I'm gonna do. So I'm gonna erase all this stuff here. We'll make room for our deltoid, which we'll draw. You guys are like, oh no, we're erasing it, that's alright. It's actually starting to look more like an arm now. And this deltoid has fibers that stretch down like this. insertion goes like that. So now, everything in red is deltoid. And let me outline this guy so you can see it a little better. It kind of comes down like this and inserts right there. And he'll have different kind of striations of muscle. Cool? Alright, so that's the upper arm. You got the triceps, brachialis, biceps, and the deltoid. Now let's talk about the muscles of the lower arm. Okay, we've got this one pretty large muscle. It's kind of the largest muscle of our lower arm. This guy is called the brachialis. Brachioradialis, excuse me. So the brachioradialis, what he does is he's a muscle that stretches. Let me see, get a good color. I'll do this guy from brown. What this guy does is he stretches from the humerus and he extends all the way down to the styloid process of the radius, which is the very tip end of the radius right there. This is the largest muscle of your forearm. Kind of makes up that muscular section right there. So he's going to extend from right about here, and he's going to come down, and he's going to go all the way down to the radius like that. Which means that we can go ahead and erase all these guys because now they're covered. We'll keep that section right there. So this guy comes down here, and he really occupies that lateral border. Oh, this marker's dying pretty bad. But this guy in brown, in the light brown, is the Brachioradialis. It's a perfect name. Brachio, arm region. His origin is right here, kind of the distal third of the humerus, and he stretches down to the radius, the very tip of the radius. His job is that he helps with elbow flexion a little bit, but he also, if you really rapidly extend or flex your arm, that brachioradialis becomes active to help kind of stabilize that rapid extension. So the brachioradialis goes like this. And down. Okay. Right next to the brachioradialis, we've got a muscle that extends the wrist. So here's a good rule of thumb. All these muscles that are on the posterior side of your forearm, when they contract, they're going to extend either your wrist or your fingers. All the muscles that are on the anterior side of your forearm, they're going to flex your wrist or your fingers. Okay, so posterior side, extensors, anterior side, flexors. This next muscle, his origin is right beside the brachioradialis. He is called the Extensor Carpi Radialis Longus. I'm going to draw this guy in orange. Okay. He kind of comes down like that. He's not a huge muscle, but he's located right here, and he has a long tendon, hence the longest part of his name, that it's going to stretch all the way down to the wrist. So let's think about his name. Let me write out his name. He's the Extensor Carpi Radialis Longus, and he's right beside the brachioradialis. What? Yes.
Is that this one right here?
Yes.
Or
That's
this
exactly. No. The first one. That's exactly it. Okay, right beside the big brachioradialis. So let's think about his name. Extensor. What does he do? Flexor, extend. Extend. Carpi. What does carpi mean? What's the carpal region? The wrist, right? So he extends the wrist, radialis. Is he going to attach on the radius side or the ulnar side? Radial side, longus. So this has a muscle with a long tendon who extends the wrist, and he attaches on the radial side. His specific insertion, if you were to follow it down, is actually right here, the base of the second metacarpal. Boom. Second metacarpal leads to your index finger that's on your radial side. So he stretches from here all the way down to the base of this index finger metacarpal. When he contracts, boom, he helps to extend that wrist. You got another one that's right beside him. This is the, if we got a longus, we're gonna have a brevis too. The extensor Carpi Radialis Brevis is right beside him. He's gonna come down like this, and he's gonna extend all the way down here. So, extensor Carpi Radialis Brevis. All right, what he does is he, yeah, that's right. So his origin is the lateral epicondyle of the humerus. So this little bump right here, like the distal end of the humerus, just a little bit further down than his buddy. He stretches all the way down to the base of the third metacarpal. So he attaches right here beside him, but at the base right here. So let me fill in his little outline. He comes like this, and he comes down like that. And that's your extensor Carpi Radialis Brevis. Both of those guys extend the wrist, they attach on the radial side. Alright.
They're kind of like over the radius. Like those three muscles are directly right over.
That's right. Yep. So they over the radius but on the posterior side. So make sure you're on the posterior side. They just go right over the radius and they attach on these second and third metacarpals. Boom, right there. Now, next to these guys, alright, we've got a pretty long muscle. Also originates from that same lateral epicondyle of the humerus. This one is like a landmark muscle. Remember how in the bones, if you find your landmark and you know that's a certain bone you can work out? This is an easy one to identify. I'm going to draw him in green. He starts here, and he comes down, and he comes down, and what he does is he branches into 3 tendons that go out to our second, third, and fourth phalanges. This is your extensor digitorum. With a name like that, what do you think he does?
Extends the fingers.
Extends the fingers. These 3. Second, third, and fourth fingers. So this is your extensor digitorum. I'm going to outline him. My outlines are getting all messed up. Alright, so he comes down, he branches out, he goes to the ring finger, he goes to the index finger, and he goes to the middle finger. Extensor digitorum. That's his job. He extends those fingers. My neighbor was working on his motorcycle, right, a couple weeks ago, well actually a couple months ago, and he popped the top of his hand, popped his extensor digitorum tendon, right, the common tendon that feeds all those guys. Yeah, he couldn't extend these fingers, especially these 2. Your index finger has a dedicated another extensor. That's the extensor Pollicis, extensor indicis, right? Their index finger extensor. But these 2 guys, your middle finger and your ring finger, that's the only extensor they have. So he'd just be like this. He could flex, but if you wanted to grab anything, you'd have to. If you wanted to like grab a drink, you'd have to be like open them and then grab. Because it took him like a week to get into surgery. And then they fixed it, right? They went in there and they pulled the tendon out and they repaired it. It was shorter now, so it was super tight. So then his fingers were like this. And then he had to like, over time, like stretch out that tendon. But this is a very commonly severed tendon. Oh, okay. Next up, I'm going to draw this guy in red and better red. Another muscle. His origin is still at that same lateral epicondyle of the humerus. This guy is going to come out and come down here, and then he attaches to the base of the 5th metatarsal, pinky finger. your extensor Carpi Ulnaris. Perfect name. This is extender flex. Extends. Extends the wrist. He attaches on the ulna side. Base of the fifth metacarpal. Right here, your pinky finger. So if I were to outline him, he goes down here like that. Like that. And that's the name of all of your major superficial finger and wrist extensors. There is one muscle that makes up the lateral border of the forearm in this case. This is actually a flexor. This is your flexor Carpi Ulnaris. We'll talk about him more when we look at the other view, but he's the main muscle that forms that lateral border because he's big. I'll draw him in this light blue. He starts right here, and he is going to occupy this entire kind of border of the forearm in this direction. So if you're looking at the posterior view, and so this is the flexor Carpi Ulnaris. If you're looking at this lateral view, the two muscles that make up the border of the arm, even though you're looking at the lateral view, they're not extensors, they're flexors. They're just the big ones. Like, here's a flexor, the Brachioradialis, and here's another flexor, the flexor Carpi Ulnaris. Let me fill in, you know what I mean? There's only two more muscles that we can see from this view. I'll draw this next muscle in a green, this darker green. You got a muscle that actually wraps around like this. Wraps around the wrist like this. And you can almost see it. There's like a little bulge right here on this side of the wrist. This guy in green that I just drew, he's called the abductor Pollicis longus. Abductor Pollicis longus. With a name like that, what do you think he does?
Pulls or abducts or
Abducts.
abducts.
Which finger?
The
The thumb. Okay, and he's got a long tendon. I didn't draw the complete origin of this guy. This guy actually originates on the ulna, right about here, wraps around and has a tendon that goes right here at the base, or at the base, or on the first metacarpal. So when he contracts, boom, he abducts that thumb. And he wraps around like that. Right next to him is another muscle that has a similar path. Also, his origin is right here on the ulna, wraps around. This is the extensor Pollicis Brevis. I'll draw him in purple. And he wraps around like this. Extensor Pollicis Brevis. With a name like that, what do you think he does?
It extends the thumb.
Yes, he extends the thumb. So his insertion, where would you guess his insertion is if he's going to extend the thumb like that?
Base of the metacarpal, the first metacarpal.
Oh, close, close, close. He's actually got to be further out because he's got to span this joint right here, right? Where do you think he's going to insert? He starts right here, the ulna wraps around, and his action goes like this. So where does he have to insert? Let me ask it in a better way. Can he insert here, or does he have to insert out here?
Out there.
Out there. So he actually inserts at the base of the terminal phalange of the thumb. Right, he inserts right there. So when he contracts, boom, he pulls on it, boom. And if we fill in, like the shape of what's going on, here's the thumb, here's the hand, right? Boom. You got the fingers. We've got a good, complete picture of the arm. Okay. The only ones we're missing is that, we did a pretty good job. Oh, yeah, there's a muscle called the Anconeus that what he does is that he's going to wrap around like this, and he just fills some of this space like that. Don't worry about his action or function, just be familiar with his location. So that guy in red, that is your Anconeus. There's a muscle that's right beside the extensor digitorum, and his tendon goes out to the pinky. That's called your extensor digitorum minimott. I'm going to draw him in brown. He's right here, and he goes right out to the pinky. Tiny little puny muscle, because his only job is to extend that fifth phalange. And he is the extensor digiti, D-I-G-I-T-I, minimott. M-I-N-I-M-I. Let me outline this guy. So there is, in green, that's your extensor digitorum, and then in brown is your extensor digiti minimi. And now we're good. Right arm, we got the right arm from the lateral view. We're doing the same right arm, but imagine like this view, with the right arm kind of relaxed like this. That view, which is view like this. Okay, so you're looking at kind of the medial side with the hand just relaxed, so the thumb's pointing at you. And what I've drawn, same type deal. The bones are in orange. You've got your humerus here. This is the medial epicondyle of the humerus. Remember him, that little bump on the inside of your elbow? This is the trochlea that connects to the ulna. And then this is the capitulum, which connects to the radius. You got your radius, you got your radial tuberosity, and because of the way this arm is positioned, the radius crosses in front of the ulnus. The ulnus like in the background. You guys kind of see that, like the ulnus in the background. Up here, it's pretty easy. You got the head of the humerus, you got the greater tubercle, the lesser tubercle. Then this is the distal end of the clavicle, okay? That meets the acromion right here, so I went kind of lazy in drawing the scapula, but that's the acromion of the scapula. This right here, that's your coracoid process of the scapula, that little protrusion. And I mean, this is literally what you're looking at from this exact same view of the skeleton. So there's the coracoid process. And this right here just represents the back of the scapula going backwards. Okay, so that's like the lateral border of the scapula. Everybody with me? Now what we'll do is we'll start with the biceps. I'm not going to draw the brachialis because he gets covered up so much, but I'll give you an idea. First, actually, I'll just give you an idea of where the brachialis is. We drew the brachialis in blue from this side. Where's the origin of the brachialis? It's right, like halfway down the humerus. What's the name of this bump? Deltoid tuberosity. So we know the brachialis is going to originate right here. There's that bump, the deltoid tuberosity. What this the brachialis, does, he starts right here and he's going to wrap around. And which bone does he insert on?
The olecranon.
Ulna. He goes to the ulna. So he's going to start right here, and I might as well draw him real quick, right? So this is your brachialis. He starts right here, and he wraps around and inserts on the ulna, which is right here, okay? So there's the ulna. I'm messing up our medial epicondyle, which is going to become very important here in a second. But that's your brachialis, and I've already drawn him. So he really just curves around, okay? Now let's talk about the biceps. We know the biceps. We've already talked about him to some degree. He's got two heads. Where's the short head originate from? Coracoid process, right? That's right here. The other head originates from the glenoid cavity. He goes right between these two tubercles. So I'm just going to draw the biceps. And we know the biceps is going to go right on top of the brachialis. That biceps, where does he insert? What bone? Radius or ulna?
Radial.
Radial tuberosity on the radius. That bump right here on the radius. So here, we got the biceps, we got the long head, which kind of comes in like that, and then he gets bigger and he inserts right there. And then the short head, he starts right here, he gets bigger and he inserts like right there. So this guy is our biceps. And he sits right on top of that brachialis and he stretches down like that. Okay? So everybody in green is the biceps. I don't even have to label this guy because we already labeled him in green. I'm just gonna outline it. So here is the biceps. He starts right here, comes down like this. This side he comes down, and he inserts right there in the radial tuberosity. Okay, there's another muscle whose origin is also in the coracoid. Short head of the biceps starts at the coracoid. The Coracobrachialis starts at the coracoid too. He sits right underneath the biceps. If you look at your model, he's this muscle that's right here. If you look at somebody who's like very lean and muscular, you can see this. Like sometimes you'll see this on like basketball players, like NBA players. This is a muscle right underneath the bicep, and this helps to adduct the arm. He's a perfect name, Coracobrachialis, Coracoid Process to the brachial region. I'll draw that guy in red. No, red's for the deltoid. How about this dark, weird blue right here? So you go from the coracoid process right here to the brachial region. And that's about as much of him as you can see.
So you can't see him on the other view. Right?
Can't see him,
Okay.
right? Because he's on that medial side.
Okay.
Right, he's on the medial side, and that's a good point. His outline looks like this, and he comes down like that. And the medial side comes down like that. And this is the Coracobrachialis. Coracobrachialis. And his main function is he adducts the arm. That makes sense. He pulls and he adducts the arm. This will definitely be on the exam. Everybody gets this wrong. I don't know why. But I have a picture of this model on the exam. It points to that muscle right underneath the bicep on the medial view. That's got to be Coracobrachialis.
So you're telling us that's going to be on there?
For sure.
Okay.
Right. Now we can just talk about the triceps. Okay? Yes.
So wait, did you say abduct or adduct?
Adduct. ADD. Right? So it pulls it closer to the body. We got the triceps. Okay? The lateral head of the triceps. We already drew him. When you turn this guy around, you can see a little bit of him from this other view. I think I got a better purple. No. Oh, I do. So this triceps, you can see that lateral head kind of coming out like this, you know, on that side of the biceps. The medial head is right here. He's kind of the thicker head of the triceps. This medial head, he's the one that originates from the scapula, that lateral edge of the scapula. And you can kind of see he's thick. He starts right here on that lateral edge of the scapula. The other two heads, the lateral and the long heads, they start at the humerus. So that's the lateral head. The medial head is right here. And this guy, he stretches all the way up to the humerus. So if I were to outline these guys, that's the lateral head of the tricep. It comes down like that. This is the medial head, which comes like this. And then the long head is like that. Okay? Now we can cover all these guys up with the deltoid. The deltoid is the big old muscle that I drew in red. He is going to cover all of this, so I'm just going to go ahead and erase this whole portion right here, because all this is covered up by the deltoid. And that deltoid looks like this. That's good. He kind of comes up like that, like this. Fibers kind of run like that. And if I were to outline him, he would look like this. And that's the deltoid, to an extent. Okay. And that's already labeled, so we don't have to worry about it. Now, let's talk about the muscles of the lower arm. What's the biggest muscle of the forearm? We already labeled it. Brachioradialis. This guy, his origin is on the humerus, okay? And his insertion is at the base of the radius. Here's the base of the radius right here, okay? The styloid process of the radius is right there. So this guy is gonna start at the humerus, he's gonna wrap around, and he's gonna insert right there.
Where did you say the insertion was again?
The styloid process of the radius. So really, the styloid process of the radius is the very tip of the radius, right there. Right there. And that's where he inserts. So this guy wraps around, inserts right there. We've already labeled him, so I don't even have to label him again. He goes like this. Oh, my red is kind of, or my black is running out of fuel. Alright, now there's a whole bunch of muscles that originate from that medial epicondyle. I covered up that medial epicondyle, but he was right here. Remember that? That's the medial epicondyle of the humerus. He's right here. There's a series of 5 muscles, or 6 muscles, that originate from this guy, and they go in a very specific order. The first one is called the Pronator Rotator. I'm going to draw that guy in red. He starts right here at the medial epicondyle, and what this guy does is he goes right underneath the, he goes on top of the biceps, and he goes right underneath the Brachioradialis, and inserts on the radius. So he stretches from here to there. His name is the Pronator Rotator, T-E-R-E-S. With a name like that, what do you think he does?
Pronates.
He pronates the forearm. And that makes sense. He stretches from the medial epicondyle to the radius. When he contracts, boom, he pulls him right over. Okay, next up we've got a muscle. I'm going to draw this guy in orange, I believe. This guy starts in medial epicondyle with the Pronator Rotator. This is called your Flexor Carpi Radialis. With a name like Flexor Carpi Radialis, what do you think he does?
Flexes the carpals.
Flexes the wrist and attaches on which side? Ulnar side or radial side?
Radial.
Radial side, you got it. There he is. He attaches right there on the radial side. Specifically, he attaches at the base of the second metacarpal. So he's going to attach right. And that makes sense. If he's going to attach there, when he contracts, he's going to flex that wrist because he's pulling right here at the base of the second metacarpal. I say second? It's the second metacarpal. Okay. Next up, we've got a muscle called the Palmaris Longus. Not only 85% of people have this. 15% of people don't even have this muscle. He's a pretty special muscle. He's a landmark muscle. He's one of those that's very easy to find because he starts right here at the medial epicondyle and he stretches down to the very middle of the palm. His insertion is the palmar fascia, right in the middle of the palm. And if you look on your models, there's a tendon that stops right here, right? Like it's right here in the middle of the palm. That's called the Palmaris Longus. So you got the Palmaris Longus, and 15% of people don't have this. The way you can tell if you have it is that if you flex your wrist like that, you see that line right there? That's the tendon of the Palmaris Longus. I have it. Okay, but if you go like that and you don't have that little tendon, you don't have that muscle.
That's when you have like that divot in the wrist, right? If you don't have it.
I have it.
It has no, don't worry, it has no effect on forearm strength. Right, or anything. But he starts right here and he goes down.
Like a hole?
Yeah, if you ever see somebody flex, they have like a hole going into their wrist.
What does it do?
It helps to flex the wrist,
Okay.
right? Because all it does, it stretches from, you know, medial epicondyle right down to the fascia of the palm, and he just helps to pull like this. But you already got two big muscles that do that anyways. You've got the Flexor Carpi Radialis, and the next one that we haven't talked about, the one, well, actually we have talked about him. He's in blue. Flexor Carpi Ulnaris. That's the one that's right beside the Palmaris Longus. So right here on this side, and then we're basically done with the arm. You got the Flexor Carpi Ulnaris. It goes like that. Medial epicondyle is the origin, and he is insertion. Doesn't even look like blue, unfortunately. His insertion is the base of the fifth metacarpal. He also inserts right here at the pisiform and the hamate. You know, so just right here is where he inserts, right on the other side of the wrist, and that's him. Okay. We're gonna draw this out. You got your thumb. Right. Okay. So those are the, what's that blue muscle as a review?
The Coracobrachialis.
Close. It's just that guy.
Oh.
Brachialis. Because remember he wraps all the way underneath? And
Wait,
inserts on the palm.
which blue?
Sorry, this dark, this light blue.
Oh, okay.
That's Brachialis. He's a tricky one. Okay. Good. There's only a couple more things I want to talk about. There's some deeper muscles that are very important. If I were to peel back all these flexors, so the Pronator Rotator, the Flexor Carpi Radialis, Palmaris Longus, and the Flexor Carpi Ulnaris, so I'd pull off red, orange, green, blue. Keep the Brachioradialis. The Brachioradialis is going to be right here. Alright? And he stretches like that. That marker's so dead.
Can you move the skeleton, please?
Yeah. So in this guy, you still have the Brachioradialis that stretches down like this. What you'll find is there's a pretty broad muscle that's underneath him. He also inserts at the medial epicondyle. He stretches down, and I mean there's one motion that we haven't talked about yet. That's flexion of the fingers. There's this pretty large muscle. He's called the Flexor Digitorum superficialis. So he starts at the medial epicondyle and he comes down here, and he is going to innervate all of our fingers except for the thumb. And that allows flexion of those fingers. So that's your Flexor Digitorum superficialis. If we were to peel back that layer, you're going to have just one more set of muscles. So let's pull back both Brachioradialis and the Flexor Digitorum superficialis. You're going to have a deeper flexor muscle. I'll draw this guy in orange. He doesn't originate at the medial epicondyle. He's actually going to originate right here on the ulna. So he originates right here, and he just goes down and he helps to flex the fingers as well. That's the Flexor Digitorum profundus. Profundus. And then on the other side, we just have a muscle underneath the Brachioradialis. This is the Flexor Pollicis longus. What do you think he does? Flexes the thumb, and he has a very long tendon. So then you've got, in light blue, I guess I'll draw it, you've got this muscle that starts here on the radius, and he goes down, and he innervates on the thumb, and that flexes the thumb. This is the flexor, Pollicis, longus. If I were to draw this out, you obviously got your thumb here.